Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Lyon. I'm sitting at Neck of the Woods Brewing Company with two good friends of mine, Dr. Frey and Dr. Brant. Gentlemen, how are we doing this evening?
Fantastic.
Good. How are you?
I'm so good. So good to have Dr. Brant back. I feel like it's been so long, but
I know.
it's been a little bit.
I think the last time we wanted to have you on was similar topic, just on the other end of it, and then you got bogged down. Life gets in the way. You got caught up.
Right.
Watching the kiddos, whatever it was.
Yes, it's good to be back. I'm glad. I always have a good time.
And
Thanks
things
for
have
having me.
changed a little bit since your last time here.
Yeah, now we got some cameras set up. It's a little different.
A little different seat for you on the
Little
opposite end of the
different.
table with some cameras in your face now.
Yep.
Right.
So tonight is going to be, we're kind of talking about something that's a little older, but I think I'm going to just start it off with a rapid fire 2 questions for you, Dr. Brant. And pretty straightforward. When you hear the injuries I'm going to talk about, I'm just going to ask you what your general guidelines is for return to play based off what I tell you or what I ask, right? So we'll start with the basic one. I think we've talked about it before, but high ankle sprain. Typically from time of injury to return to play, just give me a rough estimate of time.
I think short answer, high ankle sprain is going to be longer than a regular, inversion ankle sprain. So I think if you had to make just a guess of when it's going to be, it could be 8-10 weeks.
Perfect.
Totally nuanced answer. Like that.
Yeah.
It's no way to make that one short.
Yeah. Right. Yeah.
But he throws it right at you.
Yeah. Oh yeah. I'm
Yes or
throwing.
no?
Yeah.
I'm throwing. And so the next rapid fire question here, we're starting off pretty hot tonight, is Achilles tendon repair, a surgical Achilles tendon repair. Roughly time frame for return to play with that one.
I mean, my go-to for an athlete is, I'll tell you, a year.
Okay, perfect. So let's talk about tonight. Aaron Rodgers coming back in about 100 days, and then we're going to talk Trevor Lawrence coming back from high ankle sprain in 6 days.
Right. Yeah.
Got a lot to unload, but I just wanted to start off
Superman.
kind of the general.
Let's see where this actually goes.
Right. Like the general timelines of what, textbooks or what we all know in our professional careers and how we've dealt with these things.
Yeah.
Those guidelines are pretty accurate to what I've been taught. I mean, you're the expert on it,
That's how it's always been, man. Like those are kind of the general.
Right, the general guidelines. And then here we are
Biology
with
is biology. 2
quarterbacks in the NFL who decide to defy the odds a little bit. So, yeah, here we are. Where do you want to start? That's the best question.
So I think first, all right, let's start with Aaron Rodgers.
Yeah.
'Cause that's the one. And, and he's approaching the time that he was predicting or estimating to try to come back.
Yep.
And just so a few facts about him, right? Like, he just turned 40, right? Like,
Yeah.
he's not a spring chicken anymore. He is a quarterback. It is his left ankle, which is different as a right-throwing quarterback.
Correct.
It's slightly different, but it's still the NFL, and
Right.
he's still the quarterback. He's through his career, has been a pretty mobile quarterback. That's
Right.
part of his game, right?
Right.
And that comes into question. The injury happens on September 11th,
Right.
and he looks at. I think he was talking about possibly this week, this game that's coming up, or maybe he was predicting the Christmas Eve
The
game.
Christmas Eve against the Commanders. Yeah.
Right, against the Commanders.
Yeah.
Against the Commanders.
Oh, I'm sure that's why he targeted that.
That's
game.
probably
He just
why.
knew you-
No
He
matter
knew.
what, you come back, you play against them, you're going to look like a star. I know.
So a reminder to all, but Matt is a Commanders fan.
Yeah.
So
Yeah.
yeah. So, I think we talked about it. When we did the original show, what our kind of feeling was like, maybe if they make a run deep in the playoffs,
Right.
kind of this Cam Akers 6 months, possibly, who knows, defy the odds. And then it wasn't very long after here where he was saying, I'm going to get back, Christmas. And we're still like, no way.
Right.
But then all of a sudden, then he's out on the practice field,
Yeah.
throwing the ball.
Yeah.
First, what are your thoughts on that?
Yeah, I know. This has been a tricky topic, and it's like, because it really doesn't make sense. It doesn't fit the timeline of anybody
Right.
else who's ever gone through this.
Right.
And the quickest one, and we have discussed before, was Cam Akers.
Cam Akers, yeah.
Cam Akers came back and played in the Super Bowl, and he was like 6 months out. And I think he re-injured it around then or shortly after
did he
that.
really?
I think so.
Well,
but,
Cam Akers this year ruptured the opposite.
The other side.
The other side,
Yeah.
yeah.
But I mean, 6 months was unheard of at that point. I mean,
Right.
this used to be a career ender, you
Right.
know, and then it's like it got a little bit. People started coming back a little better, but
What
you know,
was done differently about Cam Akers and probably about, well, not probably, but definitively done slightly differently with Aaron Rodgers than some of the other ways that we traditionally repaired these?
Yeah. Well, I mean, and that's a big one, and that's a potential game changer in this is, you know, the way it was repaired. So the old standard way was you open it up,
Right.
you put it back together, you do a specific stitch, almost like
Yeah.
an interlocking baseball stitch up both sides called a crack owl.
Yeah.
You can augment that with a different little suture stitch called a bunnell, however you want to do it, but you open
Right.
it up and you put it back together, almost like a Chinese finger trap to kind of interlock it.
Yep.
And
But-
you're mashing two ends of a mop together sometimes.
Yeah, and that's
doesn't-
it.
Yeah.
Right.
So and this is it's not as new of a technique as everyone made it out to be in the media when he first had it, when they were talking
Right.
about it and everything.
Right.
It's been around for a couple of years now, but it's called a mid-substance speed bridge, a PARS technique,
Right.
which is a percutaneous Achilles repair
System,
surgery,
yeah.
where it's a smaller incision. You use a jig to reach up inside the Achilles, inside the sheath where the Achilles is, and grab that tendon, and then anchor it down into the calcaneus.
Right.
So it's almost like a buttress system where you're pulling it down in, and anytime the Achilles or the muscle will flex up to pull against it, you're also pulling up on the calcaneus. So it's basically it's earlier protection for earlier weight bearing.
Yeah. Yeah.
Like
an internal brace, a brace inside to help
Right.
protect that repair.
Yeah, it's a different technique and a different system,
know.
and I'm sure it helped him get back sooner. And there are studies, and there was a study in Foot and Ankle International in 2015, and it was that comparing the open repair versus the percutaneous repair, and it was that at the 5-month mark, where you're at in 5 months, and it's the open technique was about 82% of people can get back to physical, that level of physical activity. At the 5-month mark, as compared to 98% in the percutaneous repair technique, the speed bridge technique.
But that's not like go back out and play football. It's
No.
just a higher level
Right.
of activity from where they had been.
Yeah, at that point.
At
And
that point.
in the end, it was a very similar outcome.
Right.
It wasn't like one was greater than the other. They in the end it was very similar results, but it was quicker return in one than compared to the other. The PARS compared to the standard.
Right. And then Cam Akers had similar PARS type repair.
Yeah, a lot of the players now, I think the majority of them are getting the PARS type
Let me
repair.
ask you this also, and I don't know that this is necessarily part of the equation or scientifically part of the equation, but it stands to reason. When you do that form of the repair, when you do this PARS repair, right, it's really pretty small incision. Is there any benefit or are there any issues like less disruption of blood supply and that sort of, is that a factor in the healing process? In addition to having these other strong sutures that are backing up or bracing the repair, keeping the two tendons really close to each other throughout the whole process, as opposed to letting them gap a little bit during the process. I don't know. What are your thoughts?
Yeah, I mean, I would think absolutely that you're anytime you can disrupt the tissues less,
Right.
and because anytime you're going through just skin and that subcutaneous tissue, you're getting rid of small little vessels that can help to feed that tendon.
Right.
And so no matter what, it's preserving some of that blood supply. But I think the main benefit is the anchoring system.
The anchoring, yeah.
Right.
But no matter what, it's the timeline is exceptionally fast with
Right.
what Aaron Rodgers went through.
Yeah, and I mean, you're looking at, like we mentioned, September 11th he got injured. September 14th he had surgery, and about 77 days out after that he's returning to practice of some limited capacity.
Right.
So again, as we mentioned previously, plenty of times we record on Tuesdays and release on Fridays.
Yeah.
And on Tuesdays, Aaron Rodgers does join the Pat McAfee podcast. And
Oh,
he
that's
was,
right.
He was on there today.
Yeah.
I clipped into a couple different things, and he was talking about what he's been doing at practice, and he's been doing some 7-on-7 drills and some passing drills with like the not the 1s or the 2s, but the 3s and the practice squad guys, and getting some reps in that way.
Right.
And I
But
think
it's
there's
drills. It's throwing the ball and doing
right
some drills.
Yeah, just dropping back, throwing. I think the biggest thing, right, is like when you get cleared to play football, you have to dodge 300-pound people who can run a 4.4 40
Right.
coming at you and trying to destroy your life a little bit, and that's ironically kind of how he got injured,
Destroy
right? He
your
was,
life.
he was trying to dodge somebody planting his foot, and then you saw the reverberation in the pop.
Right. That was a big thing. Right. Shefty kept talking about the reverberation.
It was like that word was so popular.
Yeah.
That was a very trendy word that week. But yeah, and I read a couple different articles, and they're saying, he's really aggressive with his rehab. He's on a very strict diet.
Yeah.
And now he's aiming, again, like we mentioned, that Commanders game would be about 104 days post-op to return to professional football.
which is crazy.
Have you seen videos of him throwing the ball, like just watching him?
Yeah.
So I did, and I didn't know which ankle it was when I was watching before I watched the video. And the truth is, I could tell. I was like, it was his left. And just watching him out there, and I mean, moving exceedingly well, far better than I would ever expect him to be moving.
Yeah. And it does make a big difference, though, that it is his left than his right.
Right.
He doesn't have to plant off of and push off of it. I don't think if this was his right, I don't think we'd even be talking
Have this
about
conversation.
it. Yeah, I don't think so.
Yeah, because there's way more activity in that muscle to like throw a football, and like you said, to push off and generate that force to go, especially when you're trying to throw a football 40 some yards down a football field.
Did he give an indication in the Pat McAfee podcast? Did he give an indication if he's going to give this a go, or he didn't?
I think
he's been pretty coy about it up until this point.
Yeah, he's been pretty, like you said, pretty like on and off about it. But he's been saying, he's just waiting for the next couple of things to get medically cleared to do like full participation in everything.
Right.
And
but he hasn't had that yet.
Correct, and I think they're still waiting for a couple more things to or some more benchmarks to be made prior to getting cleared.
I feel like, and I say it wrong, I think it's Saleh, not Saleh, the Jets coach. But I might be butchering that, unfortunately. But he doesn't seem to be willing to commit at all in terms of and I kind of get the feeling that, and we'll see. I guess we'll see. But I have a feeling reality is set in. Like this is like a stretch to try to come back at this particular point.
But for one, I don't know if it's worth it for him to come back. One, because of the Jets' record, and also it's like he was cleared for a certain amount of football activity, but not cleared for full activity. So it's like it was kind of a loose term, and it's like I kept thinking like, is he going to be? Is he going to play like? Aaron Rodgers is like, he likes to be in the media and he likes to have people talking about him.
Very much something
where,
here we are talking about it, right?
Yeah,
like
this is exactly what he wants, right?
And it's like, is this something where he's going to be like, well, I could have played, but they wouldn't, it's like the only reason I didn't, it was because of, the record.
They pulled my reins.
Whatever. Or they wouldn't let me because of something, because the timeline just, it's wild.
Yeah.
You know?
The and I don't quite understand this part of it. Brant, I don't know if you have any more detail on this, but like once he like started practicing again, there's a ticker, like, right? Yeah, they have. I think they have to, like, go one way or the other after a certain amount of time, and I don't quite understand that part of the equation of why.
Yeah, I think that kind of goes back to if he was. I assume he was placed on IR after, and then like after that, once your practice window opens from that, you have about 21 days.
21 days
to then play, or then you go back to the IR, and I think you go back to IR for the rest of the season. Like you can't just keep going on and off on IR for like 4-week spans at a time.
Got it. So that's what that's all about.
Right.
So yeah, and I I remember when we talked about, and we've talked about this a few different times now, and you describe what the calf is like once people get up and start getting going again, and the word you use is like flubber, like it's like you got nothing back there, right?
Yeah.
So if with the addition of with the PARs and the internal brace and speed bridge technique, popularized by Arthrex, right? A very good company that we talked about. If with the addition of that, you're able to intercept the degradation towards flubber, so to speak. You know what I'm saying? So start your activity a little sooner. And a lot of this is enhanced protocols and just speeding up the post-op and the recovery protocols. So if you're able to intercept, so you don't get completely to flubber, but only halfway to flubber.
Half flubber.
Yeah. So then that means you only have to climb halfway out of that valley on the other side. It doesn't mean you're playing football, but at least you're mitigating some of the losses along the way.
Yeah, and I think that's most of it, but it's like there's also the fact maybe, we were talking about high ankle sprains earlier. It's like there's a trend towards fixing high ankle sprains earlier now, and there's a trend towards fixing them when it's like in the normal person, do you need to fix that?
Right.
So, and the same as this is, when this first happened, they were like, oh, he might come back in this, certain amount of time frame, this phenomenal, speedy time frame. I thought, well, there's no way, unless it's like his rupture was a bit different. Maybe it was a bit higher. Maybe there was more muscle involved, because it really depends on where that
kind of
rupture is.
muscular tendinous junction.
And if it was up that high, where there's a lot more muscle down into it, where that tendon almost slid on itself, instead of completely popped and gapped, because we don't know. We don't know what his rupture was. If it was a complete gap, you can't know because of HIPAA. And
And
you know,
and full disclosure, again, we talk about it every time, and I don't mean to cut you off, but we don't have access to his medical chart. We're not talking about his actual injury. We're talking about other injuries that are like his and how it usually plays out for the average individual. But continue.
And I just think that there's a possibility that, he had the type of rupture that was a little bit higher. Maybe it was more of like an interstitial tear where it's almost like it slid on itself, like you take a rope and stretch it and fibers fray and it slides but doesn't completely gap.
Right.
And on somebody like him who's getting paid millions and millions of dollars to play that, maybe it was more of the air towards let's just tighten it up with that PARS technique and cinch it down and make it so that it's more more stable to get on it earlier than if it were me and you that did it. It's going to be, hey, here's your boot, walk in your boot, physical therapy. You're still looking at, 6-8 months. But
there's a lot of logic to that. Yeah,
maybe it was a different type. It wasn't a complete tear. But in the normal world, if you came in with an incomplete tear, I would say, here's your boot. But an athlete of that caliber with that amount of money and everything riding on his back, maybe. Maybe let's just fix it. Let's tighten it up. Let's speed up the process with surgery. Kind of like what we talked about, like the high ankle, where Tua was the first of that.
Right.
There was a high ankle, and you don't typically go in and fix those, depending on the grade
lower
of the high
grade
ankle.
Ones. Yeah.
But his was fix it, stabilize it, get him back out there sooner,
as quickly as
maybe.
we can. Yeah.
Yeah, and I mean, I think just the whole Aaron Rodgers story, the whole thing, off season, all the spotlight was on him, and then the biggest stage being in New York on September 11th for the football game.
Right.
And all this stuff happens to him at the worst timing. And then now, I mean, I don't know the actual probability or the numbers of the Jets' chances of making the playoffs.
They're pretty low.
They're standing at 6-8. They have the Bills and the Dolphins ahead of them in their division. And I mean, the AFC is pretty stacked like usual. So again, why rush your potential franchise quarterback back from an injury that's like,
Right.
And then
I think he has a certain obligation, a sense of obligation.
Right.
That this was a whole big deal. I think that, for the Jets to sign him, they paid him pretty well.
Right.
And I think the Jets organization sort of felt like, here it is, man. We put together a pretty good team. We have one missing link. And they got their guy. So I think there's a little bit of obligation on his part in terms of that. I also wonder is there a little bit of a sense of frustration with where he was in Green Bay, where he was, I think, fairly consistently trying to argue for maybe a better surrounding cast. And even though they've had some pretty good teams, he was pretty frustrated. And he feels like, probably knows it. Like he just turned 40. He's not going to play for a lot longer, regardless, injury or not. And so he wants to be out there. He wants to make a push. He wants to make a run. He wants to get another shot at the title.
Another chance at a ring, right?
Yeah.
I mean, Tom Brady played till he was 45. So that's another anomaly of the higher end of things.
Yeah.
So he's got a couple more years,
Yeah.
You're not banking on a franchise quarterback playing till he's 45 every time.
Right.
This is not going to happen.
And he has a lot more resources. We talk about this frequently. With these athletes, where they just have more resources than the average individual. Right. It's his job, right, to get healthy. That's his job. Yeah. And not only is that, but is it his job, but there's just a ton of resources being thrown at him. Mm-hmm. And every modality that's available, he's getting, and every his nutrition's being accounted for. Every single factor,
every
supplement,
every variable,
every variable,
everything. Like the average Joe, right? If they tear their Achilles, they got to wake up, have their morning cup of coffee, then go to work, then go to PT afterwards.
Yeah.
For Aaron Rodgers.
3 times a week for an hour.
3 times a week, you're right.
Yeah.
Where it's different, where Aaron Rodgers is waking up every day, going to the facility, starting his training at whatever time they start practice, typically probably super early in the morning, probably like 6 a.m. He's probably, I would assume, probably one of the first ones in, probably one of the last ones out. He kind of has that, reputation of being one of the leaders, right?
Right.
So, that's what he's doing, his daily, daily routine kind of, you know what I'm saying?
Absolutely.
I'm going to use that as a little segue right there. So for sure. And I am one of those coffee guys that you're talking about, right? And I drink coffee till no end. And a little while back, I want to try to switch things up, and I find myself just drinking way too much caffeine. Mm-hmm. And so I started delving in. I find I do this too with coffee, right? Like a big spike, big crash. So I started. Well, if I drink tea, I tend to a little smoother during the day sometimes. Not quite the same sort of mountain and crash.
Right.
So I started working with this a little bit, and I had some tea. The first time I had coffee, and I tried matcha. Yeah, have you ever
Tried it,
Yeah. So I put a little bit in my coffee. I thought my heart was going to explode. Like that was a bad idea, right? So then I was like, well, let me try tea, and I brew a big thing of tea, and I put it in my fridge, and I put a little bit of the matcha in my tea, and that was pretty well, nice and smooth. And I kind of like the flavor, and then I started messing around with it. I put a little milk in there, and I change it up, and it actually works pretty well for me. And then we stumble upon another product, and so real quick, there's a Magic Mind is a product out there, and they've kind of perfected what I was trying to do, just in a much better way.
Right.
Like so you can just go and you can just order it. You don't have to worry about preparing it for the week, ahead of time and having it ready to go. And it's same basic idea, and where there's some caffeine in there, but it's not hammering you with caffeine.
Right.
And there is, and at the same time, they're trying to find that sweet spot, right? That sweet spot between I have enough energy that I'm not crashing, and I can be productive, but at the same time, I'm not jittery. I can focus and whatnot.
Right.
So they've added all these other ingredients, a number of different like lion's mane mushroom, and I always struggle saying this particular one, the ashwagandha and whatnot. And I think the whole idea is kind of finding these things that tend to be a little bit more calming. You mix them in with that level of caffeine, and you're finding that little sweet spot.
Right.
So gave it a go. Talked to I have friends at Magic Mind. I have to say, I enjoy it. Worked out pretty well for me. Yeah. I think some people will drink it with their coffee, on the side of the coffee, what I was doing. And you can tell me your experience about it with it, but I drank my morning coffee when I'll go like, I'll mix it up. I'll do my tea 2 or 3 days a week, and I actually put in a little bit of vitamin C. That's the other thing I dump in there with my mix. And but then I'll mix it up in between days of coffee. So on the days where I'm drinking just the coffee, about an hour or two later, a little before, try to prevent that lunchtime crash, then I go with my little bottle of Magic Mind there.
I would say kind of similar. I'm trying to replace my second cup of coffee with it now.
There you go.
I've been using it a little bit, and it's like I usually get my first cup in the morning, and then by like 1 o'clock, I'm like, I need another one,
Right,
and it's like,
right. And that's what I do too,
yeah.
right? Like I'm combating like my coffee crash with another cup of coffee.
Right, and I'm trying to do 2 things at once. I'm trying to push back that first cup a little bit so that pushes a little longer, and then I try to get the Magic Mind in to push me to the next level so I don't have that crash. And then, again, same thing, like crashing. It's almost 7 o'clock now, crashing by like 6. I took it today, and I still feel like I'm kind of flying high
Feeling
right
pretty
now.
good.
Yeah, and I can't complain about that.
But anyway, all right. So back on to Aaron Rodgers.
Yeah, exactly.
So what's your prediction here? Do you think that there is a reasonable chance that Aaron Rodgers gets back? Let's say at any point, let's say the 21-day thing wasn't a factor, and if the Jets did make a playoff, would it have been a possibility for Aaron Rodgers to come back? Let's say they make a push or a run in the playoffs to come back at some point in the playoffs.
I would have said no if I didn't see him out there,
Right.
Moving pretty good.
Yeah.
And also the fact that, I think a big factor is it's his left, not his right,
Right.
So I think that, but I've seen the way he's moving, walking, he looks pretty good.
Yeah.
If you didn't show me that, I would have said zero chance.
Zero chance.
And I don't know if it's,
Yeah.
maybe I've been treating it wrong forever. And,
I'm pretty sure
I've got a lot of
that's
heat.
not
I've got a lot
the
of
case.
heat from patients about
Isn't
it.
that
Like,
rough? Yeah.
Oh, everyone.
Yeah.
I've got people in all different stages of ruptures that are like,
what's wrong with you, man?
Yeah,
how
and they're
come
like-
I'm not getting back?
yeah, and they're 3 months out, and I'm like, they're walking around. I'm like, oh, you're doing great. You're doing perfect, this and that. And they're like, yeah. I mean, I feel all right, but what's Aaron Rodgers' deal,
Right.
though? And
That's-
I'm like, well, I don't know.
That's,
Ayahuasca? I don't know. Because it doesn't make sense. It doesn't
Right.
make sense. And that's why it's like, I don't know if it's a different type of rupture, a little bit of less of a rupture, and they
Right.
just augmented it, or maybe it's that, maybe it's that we're not pushing, traditionally we're not pushing them hard enough.
Right,
Maybe
right.
we do need to just start pushing people harder,
Slightly
and that's
harder,
across the
right.
board for everybody.
Yeah.
And because what we've known as a post-op protocol, maybe it needs to be sped up a little bit.
Right, and I mean, it's the same thing, like pushing people harder. It's like, well, yeah, maybe someone does need to go to physical therapy 5 times a week instead of 3 or 2,
But that's the thing too.
But
Yeah.
but
Can
I mean, not everybody can do that.
Yeah, right.
Like, you got to have a realistic approach here. People have to go to work. People have to take care of their kids. People have to do X, Y, and Z every day. They don't have time to spend their 8-hour workday just literally focusing on their body and getting better.
Right. So when I see people when they first come in with a rupture and of all different ages and athletic abilities and needs and whatever they need to get back to,
Right.
I tell them, it's that the most important part of it. No matter what, I'm going to go in there. It's going to take me X amount of time. I'm going to put it back together. I'm going to be happy with it. But the most important part of it though is what you put into it.
Right.
And people that are really motivated to get back because they got to get back to their competition, they got to get back to their sport, they got to get back to their job. It's those people that are really trying to put the time in do better.
Yeah.
The people that just have the surgery and it's okay, well, you fixed it.
Yeah.
What else? You put it back together. What else should I do?
That should be good.
They don't get there. It's the time you put in. So
I think
it's a big difference with him and what he has at his disposal.
I think you do have to be careful with that statement because, I agree, accelerated protocols are key, but you also don't want put in people's mind like it's a repair, and if you don't give it time to heal, it re-tears. Like, you know what I mean? So like you have to push it within the confines of what you're allowed to do. You can overdo it. Like you can.
I mean, I have timelines of where I think you should be hitting these marks,
right.
and that's what I base it off of. When I see him and I say, week 1 to 2 we're going to do this, week 3 to 4 we're going to do this, and it's like that's because what I know from data and what I've seen,
right?
And you absolutely can overdo it,
right?
Now, and so in a similar vein, I'm pretty sure I know what your answer is going to be. I know what my thought is, but so do you think there is any chance that he plays in that game against the Commanders on Christmas Eve?
Well,
I put you on the spot.
If it was a different team, no. he's real safe out there with Washington on the field. What I truly think is going to happen is they're going to. He looks good. He looks like he could get out there and
Let's
do it.
Let's say they beat Miami this week and they still have playoffs hope.
But I truly think it's going to come down to he's not going to play.
Yeah.
And it's going to be some deal between. It's going to be like a decision between the coaching staff and this and that. And he's going to say I should have been out there, but they wouldn't let me.
Yeah.
That's what I really think is going to happen.
Yeah, and I mean, I think, like you said, I think you hit the nail on the head there. Like, if they pull an upset out and beat Miami, they're sitting at 7-8.
Yeah.
They're a game away from 500. Maybe.
Yeah.
There's a chance. And I think also with this whole Aaron Rodgers things, I think he's going to have a ripple effect similar to Adrian Peterson did back a few years back when he came back from ACL 9 months and
ruined it for everybody.
Leading rusher in the NFL. You know what I mean? He hit 2,000 yards after an ACL tear in 9 months. I think it's going to be the same exact kind of ripple effect of that. The big name person.
Absolutely, there will be.
Did really well. And I think, unfortunately, everyone at this table, Dr. Brant's going to get the heat of it the most. He's going to be the one seeing these patients.
Oh, I'm getting heat. I'm getting heat every day.
Right.
What's funny is I have a buddy who does what I do in New York, and he's a Jets fan.
Yeah.
And he was texting me about it and was like, how is this even possible? Like, everybody's all, like, getting that same heat. And he was like, I don't know. He's like, as a Jets fan, he's like, I don't know if I want to see him go out there and, make a comeback and kill it or go out there and re-tear it.
This way,
because it just
alleviates all that, undue,
joking,
unfair pressure.
But really, it's like it just doesn't make sense.
Yeah.
Right, because, either of those two scenarios, right? If he goes out there and does really well, it's like, holy cow, what's going to happen from here? Or it's like he goes out there and re-injures it. Well, that's why you don't go so fast.
Right.
Yeah, right.
Now, I'm going to open up Pandora's box here and completely coming out of left field and like based on nothing other than I'm making this up. But so it was fixed by Neil Elatrash, who's and I don't know if I pronounced it, but Carlin Job, who's a very, very well-known sports medicine doc. But he's not foot and ankle. He's sports medicine. It's mostly shoulders, elbows, and whatnot. And he's the one that fixed it. And part of me almost wondered, like, could he have been misinformed about protocol, and like that's why his mind has gone to it? Because I don't
that
know
or he's
that
sweating.
Right.
Big time.
I mean, I would think like that's what I thought about too initially. It was like, when you clear him for activity, it's like, are you thinking like, oh god,
I hope
it's
this
good,
works. Right. I me personally, if I would still wager a lot of money that there's no chance for him to play on Christmas Eve. I think what he's doing right now is amazing, and I can't take that away from him. Right. I would have guessed that he would not have been able to do what he's doing. Like if I had fixed it and he came up to me and said, "Hey, do you mind if I go through this ball?" And I was like, are you nuts? Like,
Yeah.
no,
Yeah.
no way. But nonetheless, there he is doing it and doing it pretty well. So I guess we'll see. Who knows? But I would just be really, really surprised. It's biology, man. I just don't understand.
It
Like, it's
doesn't make
biology,
sense,
and
though.
you can only accelerate it so much. And
Unless it was a different type of tear,
Yeah.
a lesser
like
tear.
you said, that would be
you know?
the fact that we
That's
don't have that information.
We don't have that
That's the
info.
big X factor, I think, right there.
So I think that kind of leads us then now into the two other guys that we wanted to talk a little bit about. Similar type injuries, treated totally differently. On one side, Trevor Lawrence. Tell us a little bit about that one.
Yeah, so Trevor Lawrence got hurt on a Monday night game 2 weeks ago now, I guess, right? And then he looked pretty catastrophic. Everyone's all worried about Trevor Lawrence. I unfortunately didn't even see the video when it happened, but then I saw it afterwards. I said, oh, that was a good one. You know, that he definitely got a good twist on his ankle there.
Yeah.
And then, all week it was questionable game time decision. And then I think 11 o'clock for a 1 o'clock game, they're like, he's playing. And they're like, what? He just had a high ankle sprain?
How? Right.
Like,
right.
Oh man, that's kind of crazy to think
Yeah.
that he comes back so fast. And I think it was very close timeline for the Kenny Pickett injury.
The other one. Right.
And then he goes the opposite way. He's
Yeah.
on IR at the end of the season. He's getting surgery.
Yeah.
So-
well, I don't think he's out for the season, but he did get surgery.
Right.
Yeah. So and I was a little surprised. So Kenny Pickett was 2 weeks ago. And it's been a disaster for the Steelers ever since.
Yep.
But injured during that Arizona game, lose to a 2-10 team or whatever it was, some horrendous record. And then last week lose to the Patriots, who, I mean, I guess Belichick, you just never know. But like, come on. And
Right.
right. But I was surprised for Pickett. It was like he got injured. It didn't look that bad. And the next day, it was even actually later that night, they said he's getting surgery tomorrow.
Yeah.
Right on in, tightrope. Another Arthrex product, as luck would have it. Tightrope to try to hold those two bones a little closer together and to try to get him back on the field a little more quickly. And they said, no, not season ending, which in all honesty, I wouldn't have expected it to be, especially with the addition of the tightrope, depending on the grade
Right.
of the injury. But how can it go so different for two different guys? And then, tell us a little bit about the variability here with these high ankle sprains.
Yeah, well, I think so. You mentioned Belichick,
Right.
like the, so secretive about injuries. You
Right.
never know. And it's like I think a lot of it is, you don't know really how bad the injury with Trevor Lawrence was, and
Right.
it could be a high ankle sprain. But I think a lot of times these teams kind of play the game of how injured are we? Do you have to prepare for Trevor Lawrence, or do you prepare for the backup?
Sure.
So I think that's a big part of it. And he did look very injured, and was helped off
They
the
were
field.
carrying
Wouldn't take
him.
the
Yeah,
cart,
yeah,
but and when you think about high ankle sprains, it's different than an inversion sprain, and it's you're injuring your syndesmotic ligament. It's the
Remind
ligament,
us a little bit the difference there between those two.
ligament between your tibia and your fibula. So it's above the level of the ankle. It's basically three components: a front, a middle, and a back. And anytime we're talking about these guys that are questionable to come back, it's a grade 1 injury where you're just injuring the anterior portion of that ligament.
Right.
If you're injuring the middle or the posterior, it's done, your surgery.
Right.
But any type of question mark, it's got to be a grade 1 injury. And then even within that grade 1 injury, it could be different levels of grade 1.
Right.
So these guys are getting MRIs off the bat. Someone
Yeah.
comes in to me and they roll their ankle, X-rays are negative, spacing in the joint is normal. I'm going to say take your boot. We'll see how you do.
Yeah.
We give it a chance for a few weeks. If you kind of plateau, then we get an MRI at that point.
Right.
These guys are getting MRIs that night or the next morning to say what do we do? Because they need to know right away.
Right.
So they could have a little bit of fluid tracking up in there, a little partial tear of the anterior aspect of the syndesmotic ligament, so a grade 1 high ankle sprain. And at that point, it's how do you feel? Can
Right.
you do it? They're taped up.
Yeah.
They're taped up.
Are they ever getting injected just so they don't feel
I
it
mean,
quite as much?
Yeah, they
Yeah.
do. They do, but it's
know if
not
it's in
not
their
the
best
most
interest.
recommended thing.
Right,
but
right.
but they
Kinda
do.
like the,
So
Super Bowl Mahomes treatment that we don't
exactly,
know about, right?
that was exactly it.
Right.
So
Yeah.
so Trevor Lawrence, I'm sure, had a grade 1 and probably a mild grade 1, but I'm sure they
Is it
played that as
possible-
well as how do you have to prepare for him or not?
Is it possible it was just a lateral ankle sprain and it was just
And maybe it was. I mean, they said high ankle, which
Right.
is
Right.
which is a different ligament complex.
Yeah.
I don't know how
And that's what we're
truthful they
going
have
with.
to be with that,
Right,
but so if it's a mild grade 1, it's how do you feel, and
Right.
if you tape it up, can you do it? So you test it out in practice.
I read a paper a while back, and I might be getting this wrong, but if from what I remember, and actually I haven't really used it a whole lot in practice, but the athlete first comes in, pretty soon after that injury, you palpate kind of right up their ankle, right up along the syndesmosis, and the amount of centimeters up that you go for the pain to then disappear where they don't feel it correlates with the amount of weeks they're going to wind up being out after that injury. And I don't know if there's truth to that or not, but I do remember reading that paper like, I mean, I could see like the worse the injury, the higher the pain goes, and then that kind of gives you an indication. Yeah, this guy might get back a little sooner. This might take a little longer. But I don't know.
Like I said, with those guys too, is that they have their MRI right off the bat, which we don't typically do for normal people.
Yeah.
So
I mean, really not the standard of care at all, but like all those rules change in that setting.
And really, it's like the way I explain it too is I don't get an MRI off the bat on the person who just needs to go to their job,
right?
Because if you take an MRI too early, it's almost like a
bomb
false
goes
positive.
off.
It's like you're going to see a lot more. You're going to see more fluid.
Right.
Signals everywhere. It's like, oh my God, this is lit up like a Christmas tree.
Yeah. So you give it a chance first, and they don't have that. And somebody, if they had the MRI on Kenny Pickett and it showed a complete anterior syndesmotic rupture.
Yeah.
Then you know he's going to be down for 8 weeks or 12 weeks, or if you can stabilize that with a tightrope, which is just a button fiber wire in between to cinch it down in between so it can't gap out and spread anymore.
Right.
It's almost like a seat belt for the ligament.
Right.
So so why not? So you can push it at that point, because a syndesmotic repair, you're not really going in and repairing the fibers of the ligament and putting them back together.
Yeah.
You're putting a button, a fiber wire anchor in between and holding it in place so that it can't go anywhere.
Yeah.
And there's nothing for it to do but scar in and heal anyway. Right?
So and
so you can push back early.
So for a little bit of clarity's sake, there's the fiber wire. It's not actually wire. It's a very strong, super strong suture, and it's very thick. It's almost like a thin rope, but it's super strong suture. Mm-hmm. So stitches that kind of go between the two. That's number one, and then number two, it works by almost like you had said, like Chinese finger trap mechanism. As you cinch it down, it actually tightens on itself. So then as you try to pull it back out, very similar to as you try to pull it or lengthen it again, it won't. It just actually tightens on itself. Right. And it is super strong. Like it is a very, very powerful, strong construct. And so if the ligament is the rope that's normally between those two bones isn't necessarily doing its job holding the bones together, then like you said, it's like a seatbelt. It's backing it up, allowing the ligament to then scar in and heal while the bones are being held in the right position for the ligament to scar in and heal.
I think you see that without the surgery, right? Like you try to do rehab-wise and do stuff, and then that separation of the bone causes all the pain, and then you're like, this thing's not going to scar down right, and you can't kind of get stuck. Yeah. You can't go anywhere.
Yeah. And I've never had to do this, but you probably have at some point where if it is kind of missed or if it's a little bit too wide for too long, then you get scar in between. You actually have to go in and remove some of that scar tissue.
Yeah, and that's much worse.
Much worse.
Right. So if you're erring on should you fix it or not in an athlete like that with that amount, riding on them, they're going to go in there and fix that no matter what. And I think Tua started that process, doing that earlier. But it's all about instability.
Right.
If you once you put that tightrope in, it's stable. It can't be unstable anymore, and it will have to heal even while you're pushing it and rehabbing it, and getting back to it.
And it's more so than it stabilizes it more so than you could really with a brace or anything on the outside, tape, whatnot, anything on the outside. I actually wonder, is there a role for something like this? And we have a good friend from Protected on the last time around. Is there a brace that they can augment or wear in addition to the tightrope? I don't know. That's going down the line.
Oh yeah, that'd be interesting to see if that could work. And I think it's also interesting that we always talk about how these guys get the MRI the next day or whatever. And I think I talked about this after we stopped recording one night, but I ironically did a seminar that was hosted by the Jets sports medical team, and they were talking about how their MRIs are it's a different standard of care because it's a business decision based off that MRI. Like that MRI has to be traveled up to the coach, the GM, and everybody how these people are going to perform at their business, which is professional football, which is interesting to think. It's it's not, and then again, that trickles down to the general public where we see that. We're like, I want an MRI on this. It's like, your insurance might not do that way. It's not going to work that way here, but it's a little different.
So with Kenny Pickett, he actually had same injury in his other ankle. I think it was the right one this time, and I think when he was at Pitt in college. but he's a local guy.
Yeah.
We always give props to the local guys, right? Like from Motion, New Jersey.
Yeah.
So not super local, but Central Jersey.
Right.
And then I always think of him as Pitt because he went to Pitt and then plays for
Right.
Right. But has the same injury on his other ankle when he was at Pitt. He missed 4 weeks with that one, and then he has it on this particular ankle. I feel like to rush him into surgery, normally not rush him in, but do it so quickly the next day. I feel like, that MRI, it wasn't probably just a standard grade 1, it was probably a grade 2. A little more edema, like a little more fluid and whatnot. But then the 2 to 4 week time frame, I feel like, that's really more consistent with a milder injury. So I guess that's the trend in what you're trying to say, that we're being more aggressive with these types of injuries, even the milder ones, in terms of the tightrope and fixing them early.
Yeah, I think that's going, that's going the trend in multiple areas. Just like Aaron Rodgers too. It wouldn't surprise me that if he had an injury that wouldn't necessarily be fixed if it wasn't him.
Right.
Same way with this. Like, normally if you have a grade 1 injury, you don't need to go in and fix that ligament.
Takes you a lot longer to get back.
And it would take you longer to get back.
But you can still get back.
Yeah, no matter what, it's the 2-3 weeks of the the skin, the soft tissue, let the swelling go down.
Right.
But at that point, then no matter what, it's cutting time out of your rehab.
Yeah.
So no matter what, if that ligament, you might be okay in 2 to 3 to 4 weeks, but realistically it's 6 to 8 to 10 weeks.
Right.
But if you stabilize it, it's pretty much you are back and you should be pushing it and can push it structurally, biomechanically can push it at 4 weeks.
Right.
Because once the soft tissue calms down and you're good.
Then you can do it. I feel like all of this really started with tightrope, internal brace and MCL tears, right? Like it's all the same concept. You injure that around your knee, you put in this big, thick, strong brace or suture that's going to act as a brace, allowing the ligament to heal around it in the interim, and people got back much faster. Now it's just being applied in like every other aspect of sports medicine.
It's just, does everybody get that, or do you give it a chance with the everyday weekend warrior?
Right. Yeah. So no. And then at some point, the risks of surgery begin to outweigh the benefits. So for a professional athlete, maybe the risks don't outweigh.
And that's the difference, right?
Yeah, I mean, we'll see. And I think with those two guys, the Trevor Lawrence and Kenny Pickett, obviously their timeline for return is a little different. Trevor Lawrence came back pretty quick. Kenny Pickett, we'll see how he comes back, and then we'll kind of figure it out from there.
Right.
And speaking, we talked about Tua a little bit too, and he had the Monday night game. They had a crazy game.
I thought they won. I just found out like 2 minutes ago that they lost.
Yeah. And with that too is, talking ankles, Tyreek Hill had a little ankle injury last night from the not called horse collar tackle that was kind of questionable, which I thought it looked like a horse collar tackle. I mean, his hand looked like it was in the back of his thing.
Yeah.
And I read an interesting thing about him, and I was like, I thought about it because he got injured, I think, in the first quarter, didn't come back and play. He played again in the third quarter at some point in time.
Yeah.
And I was like, oh, man, I wonder if he got the Patrick Mahomes treatment behind the scenes in the locker room and had to wait for the medicine to kick in. Or there was in an article, he said that he texted his significant other, and he was saying that he goes, my ankle hurts real bad. I'm not going to say exactly what he said in the message, but he said, ankle hurts really, really bad. I'm going to need an ankle massage tonight. And she said, well, you better get the hell back out there. And so I guess he accepted the pain. He said what he said was that he accepted the pain. He just said, I'm just going to go out there and go for it. So that was interesting to see because he got injured, he got hurt. He sprinted off the field to kind of show that he was doing okay. And then he waited about a quarter and a half and then went back out and played a little bit, got another catch or two or whatever the case was. But, I mean, the Miami offense looks like a shell of itself without Tyreek Hill in it. So that's changed the whole aspect of the game there.
I guess that's how that happened. Yeah. I was watching for a little while. It was getting a little bit late. I was kind of clicking back and forth between Giants and in Miami and whatnot. And when Miami went up, I forget what. So they scored. I think it was fumble. They got the ball right back. Whatever it was, I was like, this one's over. And I didn't go back and look again like that. I just assumed it was over.
Yeah.
Guess not.
Yeah, and I always wondered about that too. Is like, do they? Like I said too. I think a lot of it is like game planning and planning for next week. It's like, what if they were like, okay, give him a little shot, go out there and just be like, we don't know. Maybe he'll be out there next week. Maybe we don't. How do you prepare your defense?
It does make it harder
without him
for sure.
Because with or without him is I think got to be a vastly different scheme.
Right. Right.
without Tyreek Hill.
Well said. Well
So
said.
they have to. That's gonna throw a wrench.
And I mean,
in.
I think it was reported today that he's day to day. So again, with that, like, how do you got to plan for him and then hope for the best, and you don't have without him because, I mean, they use Tyreek Hill in so many different ways. I think I saw a video early in the season, like he does different motions every play from different positions, different areas of the field. And it's like, how do you catch up to the guy whose nickname is Cheetah? The dude's so fast.
He's just
so
been unstoppable.
fast.
Yeah.
And you know what's
that
crazy?
team is so fast.
I was going to say is that Miami, he's not even the fastest guy on the team.
Yeah.
And he was reported to claim that there's a guy on the practice squad that's faster than everybody who plays, which is crazy.
Yeah.
So before we go ahead and close out our tab here, we're going to give a shout out to our sponsors, Energy Lab, Region's premier sports performance center and destination, Neck of the Woods Brewing Company, serving us up the coldest beers, Timbereer Productions, helping us edit and put together this video and audio podcast, Protected, a 3D medical device company that supports our podcast, and lastly, Magic Mind, who's given us this help, who's given us the mental clarity and focus for this. If you'd like to get a discount for your Magic Mind purchase, you can go to magicmind.com/medontap and use the code MEDONTAP20 to get 56% off your first subscription for the next 10 days following this episode. So thank you, everyone, and have a great night, and we'll see you next time.